What's your
Yeah.
sliding scale?
180. Because the sliding scale always start at 201 to 250 for 2 units. Okay? And that's the regular insulin.
Yeah.
NPH 35 and 5 units regular daily AM. Daily AM for them is 9 o'clock in the morning. Before you do your insulin, check first your blood sugar. Done by the check done by nursing assistant. You cannot give insulin unless you check the blood sugar.
Right.
Okay. What if the patient is a low blood sugar and there's no check? Go and do it as a nurse. If the nursing assistant do it, because you're giving insulin. You'll never know. The blood sugar might be 55 or 54, especially for patients. They don't eat the whole night. They always have a low blood sugar at times. Depends if they have a history of diabetes. Okay? Why? You prepare this in the medication room.
Yeah.
Okay? And then, wash my hands, gloves. How many? 35.
35.
I will not see your
Those
air.
lines
The
are
only
hard
one
to
I will
see.
see is your insulin. I'm watching how you draw it. 35 plus 5, right?
Yeah.
35 plus 5 is 40.
Well, you just do
But you do
35.
35 first.
35.
You don't-
It's up to you if how you feel comfortable with that. But I do everything here.
I don't do that. I do half.
You're gonna put all
So-
the air into one?
No. What?
No, she just did all
She's
40,
gonna
but she's
inject
do
it.
Yeah.
Um,
Actually,
do
kind of
it
like it like
separate
that.
'cause
Yeah, you
The
can do
lines
it.
are-
Whatever you practice there. Okay? I put
But if you
35.
did it like that too, is that okay?
Hmm?
You said
Yeah.
whatever you practice over there, but if we do it like that, 'cause we
Yeah,
think that's
if you can do it, if you get
We're not
used
gonna
to what my
marked off 'cause
technique,
that's we weren't.
if you that's what you're doing, and then
Okay.
in front of me so that I can see my 35. I wipe my alcohol. This is NPH, right?
That's
How
R.
many?
Serrano, that's R.
No, N.
But you're
Just
in
R.
Yeah, but you're in R.
You're in R.
You're
That
in
you're
the
using
R.
That's the R
You're using
vibe.
R.
Is that the R?
Yeah.
I'm thinking
Should
about.
be the N.
I thought they don't have a label.
Yeah, no,
Okay, N. Okay.
Fail.
N is what? Is it clear or cloudy?
Cloudy.
Okay. Regular is
Clear.
What's NPH? What's the pharmacologic action of? What's the peak hours?
Intermediate.
this
Oh, NPH is
Wait.
the peak hours is
For the regular?
1 to 2.
Peak.
NPH.
No,
NPH.
Which is
48.
48 hours.
48 hours.
Yeah,
for
always
NPH.
think about the peak hours. Also the regular.
40.
Regular is
It's like
regular is short acting.
Yeah,
The peak
48.
hours is like immediately,
48.
right?
Are you gonna
The
ask us
duration
this
is
while
10
we're
to
doing
18,
this?
right?
Yeah.
Hmm?
Are you gonna ask us this while we're doing this?
48.
Peak
Duration
hours
is
I will
10.
not ask you, but I'm watching what you're doing here.
Duration.
Are you putting all
Duration
the-
is 10 to 18.
I'm not very particular with the air, but how you draw it because you might be underdose or overdose.
Okay.
Okay, how many?
35.
So you stop at 5.
I like that better that way.
Yeah, but
Why?
the lines aren't like.
I'm
No,
watching.
my
See,
eyes
it's
are
in
going
front of
down.
me. 5. See?
Okay.
You see it here,
Mhm.
and then I level. I'll do my 5. Okay.
Mhm.
2, 4. I'll do my 35. Be careful not to accidentally
hit it,
push
yeah.
that one in the NPH. Okay?
Mm-hmm.
I'm not touching my plunger. See? And then how many?
35.
See, I'm in front of this.
Mm-hmm.
I level 35. It will go to
40.
40, right?
Excellent. A plus.
Don't recap.
Don't recap.
No. I just cover it. Because I prepared in the medication room
Yeah.
and then I'll go in the hallway.
Right.
They might be calling you on the nurse station and you might accidentally like you're doing like this.
Yeah.
Go straight to the patient, okay?
Technically, wouldn't they have you, if you're really doing this in the real hospital, you would switch the needle head.
What switch?
Wouldn't you get a new needle?
all insulin syringes are.
Oh,
Everything in here.
okay.
That's
But
your-
if you but if
I
you were
prepared
doing
in the medication room.
right, but if
You
you were
don't
doing
have to
not
have
if you were doing not insulin needle, if you're doing like a sub-Q or an IM.
It's different. I'll talk about that later.
Right.
Let me concentrate with insulin. Okay, Mr. Johnson, your blood sugar this morning is what? 180. But all patients, they have the regular insulin and NPH. They will inject on their own at home.
The little
So,
pen, right?
patient with a history of diabetes. They use also this one. Some use this one because
Oh,
sometimes
my
they cannot
uncle used
afford the
that
pen. That's why they use this one. They know. Okay, they were taught by the BNA how to do sub-Q.
Directly remove
Okay,
it.
put my gloves. Check name band. Date of birth, name, then what's your allergy, check the allergy, and then I'll give you your insulin, NPH 35 and your regular 5 units insulin, okay, all in one. You got it? Put my gloves, don't forget your gloves, okay? Where do you like? When is the last one that you they give you your insulin? Maybe here. Let me see if they have. This one you can give that one too. Here. Here, right? You're so cute. The same as you were looking up. Here. Okay? And here. How many inches away from your navel?
2.
Okay? Not up. It should only be here, here, and here.
That's my new face.
Okay? And you can also hear here. Your sub-Q, right?
Mm-hmm.
And then your IM is here. Your vastus lateralis. Okay?
Ah,
Okay, Mr. Johnson, don't move. I'll give you your insulin.
Oh no.
The same thing as your sub-Q. Okay? The same thing.
No, he was
Don't
like, why do
move.
you treat people like that? And she's like, I don't treat them. They just don't know what they're doing.
Away from your patient all the time.
Sharps.
Yeah. Just for bleeding before you go to your shots.
He said they're learning. You're supposed to teach them.
You got it?
Yes.
Is he a peds nurse? Or has he a peds respiratory?
Okay, we're done with insurance.